Wait a minute. Go.
Good afternoon. I am honored to have the opportunity to share the healthcare state of affairs on behalf of Cone Health System. As you can imagine, Cone Health is impacted by most of the same healthcare industry issues going on across the country. However, today's conversation will briefly focus on 4 of those issues: patient access, enhanced revenue and efficiency initiatives, employee engagement, and one historical legislative change on the horizon. Let me share a brief summary of each issue. Regarding patient access, as with other large health systems, Cone Health is constantly working to provide exceptional care to patients and families in our community through improved access measures. We are seeing record level increases in both Medicare and Medicaid share of business, which drives me to my second point: enhance efforts in managing costs to maintain a balanced budget. Along those lines, we have increased our focus on seeking out new revenue streams and evaluating new innovative ways of doing things. In regards to employee engagement, with growing job opportunities in the healthcare field, Cone Health is working hard to ensure our employees feel valued and are equipped to contribute their full talents so that they can grow professionally. Lastly, regarding a new state legislative change, the state of North Carolina will be dramatically changing the current Medicaid program administration in November of this year. Now for a deeper dive into each issue. First, let's talk about access and growth, as this is one of Cone Health's top strategic priorities. We are striving to achieve a standard for patients and customers as we grow in delivering both traditional and non-traditional services. We continue to see the shift toward outpatient services and the scales tipping in favor of outpatient-centric delivery models. To that end, Cone Health is experiencing a 50% growth in video and phone visits, as this non-traditional access point is very attractive to millennials and working parents. We also have seen an increase in our fast-track outpatient clinics, which offer extended hours, including late evenings and Saturdays, with no advance appointments. As we've seen increases in our non-traditional access points, we are seeing offset record decreases in ED utilization. This shift is resulting in improved margin performance in select areas. To meet patient access needs in some of our less fortunate service areas, we will pilot a new program this coming January. Cone Health will deploy its first mobile health unit to select high ED utilization areas. This unit will operate 4 days a week, 10 hours a day, and will circulate to various locations within the city. The unit is equipped with 2 exam rooms and 1 patient HIPAA room for registration purposes. This new service is designed to provide care to patients beginning at ages 5 and up, regardless of their ability to pay. Finally, this initiative will help us address our strategic goal of meeting the access needs and demands within our community by going directly to where those high-risk needs areas are. Next, I want to talk about cost improvement initiatives at Cone Health. With the growing Medicare population, our ACO has leveraged savings opportunities to help in both reducing costs and improving documented health outcomes. Our brand promise at Cone Health is, we promise we are right here with you. Through collaborative efforts of our analytics department, community partnerships, and our ACO, we are seeing amazing stories of hope for patients who previously had none. Cone Health is embracing the practices of lean management throughout the system, resulting in measurable savings opportunities in both clinical and non-clinical areas. Lastly, new revenue stream initiatives are resulting from growth in our special pharmacy services and newly developing infusion services. Both of these services are aligned with our purpose and vision at Cone Health, which is to connect healthcare and well-being within our community. Let's now talk about our employees. At Cone Health, another strategic priority is our people. To help build upon commitment in this area, we have implemented opportunities for improving employee value and appreciation through our CHEERS program. CHEERS stands for Cone Health Employee Recognition System. And we have another program called Key Leader of the Month. Both programs allow any employee of Cone Health the ability to send an expression of thanks and appreciation via email to any other employee of Cone Health. Acknowledgements include a general email expressing appreciation, and there are also higher levels of acknowledgement which coincide with employee performance that is dramatically above and beyond their normal day-to-day work responsibility. These higher levels include both monetary and non-monetary gift recognition. Since its launch, our employees have submitted over 50,000 recognitions of incredible acts of caring and services that occur each and every day at Cone Health. More importantly, employees feel they now have an opportunity to formally acknowledge their coworkers and management leaders for a job well done. These programs have been a huge success at Cone Health and align with our values of caring for each other. Lastly, Cone Health is committed to ongoing compensation market reviews to ensure our employees receive competitive pay for the work they perform. Finally, I want to speak to the historical change in Medicaid administration for the state of North Carolina. Beginning in November of this year, most of North Carolina's 2.1 million Medicaid recipients will be impacted by a change in how administrative services are processed. In short, North Carolina is moving to a managed care Medicaid payment model. Several months ago, the Department of Health and Human Services made final decisions on which companies would provide processing services to Medicaid recipients. 4 PLEs, better known as provider-led entities, were selected to manage this Medicaid change. The execution of this change in policy will occur in 2 phases, with the first beginning in November and the final phase beginning next February. Once Cone Health learned that we would be in the first phase of execution, we quickly compiled a team of key leaders who worked to outline our strategy for tackling the new process. Over the past few months, the team has been meeting weekly to develop processes and guidelines to address how we will navigate this change in our day-to-day operations. The biggest challenge we are currently experiencing is providing guidance to frontline staff on how to handle questions being asked by Medicaid recipients regarding which PLE they should choose. Tensions are mounting as the open enrollment period will close on September 13th. It's unfortunate that Medicaid patients are right in the middle and of this uncertainty, along with our Cone Health employees who are very uncomfortable in this position because they cannot provide guidance on which Medicaid recipients plan people should select. In addition, we have not received the final rules and regulations nor payment rates associated with this change. Without those rates in hand, we are unable to project what the financial impact for our system will be. All combined, this legislative mandate is causing disruption in our current operations. As I look to the future for Cone Health, I see us continue to grow our outpatient market and new non-traditional services as market access demands increase, and I believe we will achieve the balance needed to align providers with specific areas of need. Our market area is increasingly expanding to include competitors within reach in our areas, which were traditionally isolated to Cone Health. I see this as a continued high operational risk, which will require intentional focus as we monitor and develop our strategic initiatives for the coming years. I am encouraged with the measurable patient care and quality improvements and financial gains we continue to see in our ever-growing ACO operations and expanded collaborative community partnerships. These efforts will continue to be present in our Cone Health value for caring for our community. More specifically, this value encourages us to engage our communities with integrity and transparency. As it relates to the new Medicaid legislation, we are definitely experiencing very trying times as we navigate through the web of confusion, which is causing a lot of anxiety and concern throughout the system. I strongly believe that once operations stabilize, this change will result in improved Medicaid patient care access as well as positive patient health outcomes throughout the state of North Carolina. We are also hopeful that the system's overall financial position will improve. As I prepare to close, I saved the best for last, namely the unmeasurable positive impact of having a workforce of 12,000 plus employees who are paid fair market rates, who feel valued, who are empowered, and who are appreciated for the work they do. As we continue on our lean deployment journey throughout all areas of the system, I believe our frontline employees will rise to the challenge of solving inefficiencies throughout. With our focus on continuous improvement and reinventing care opportunities, Cone Health employees will be a key factor in sustaining our annual margin targets and ongoing capital growth to meet our long-range financial plan for a brighter future. As we continue to care for our employees, I believe they will in turn continue to care for the future of Cone Health. Thank you.